Hi, let's talk about the valves of the heart. So the heart has two sets of valves. There are the atrioventricular valves that are going to send blood from the atria into the ventricles, hence their name. And then there are the semilunar valves, which send blood from the ventricles out into a respectively named vessel. So for instance, there is a semilunar pulmonary valve, which we can see anterior there, and a semilunar aortic valve, which we can see posterior there. So the atrioventricular valves, let's start with those. On the right side of the heart, we have the tricuspid valve. The tricuspid valve gets its name because there are three cusps. There is an anterior cusp, a posterior cusp, and a septal cusp. Most of the action of this valve occurs with the anterior and the posterior cusps, and there's very little, if any, movement from the septal cusp. Now the bicuspid or mitral valve separates the left atrium from the left ventricle, and we can see that there is an anterior cusp and a posterior cusp. Looking within the ventricles, we can see how the cusps are anchored to papillary muscles via the chordae tendineae. So for however many cusps there are in the valve, there will be that many papillary muscles, and they're named for the various cusps. But there isn't fidelity between the chordae tendineae that come from a particular cusp to a particular papillary muscle. So for instance, as we can see here, there are chordae tendineae from the anterior cusp going to this anterior papillary muscle, and there are also chordae tendineae from the posterior cusp also going to that anterior papillary muscle. These AV valves are going to be open during diastole so that blood may flow freely through the atria and into the ventricles. They'll remain open through atrial systole, and they'll close in response to the increase of interventricular pressure during ventricular systole. And these papillary muscles and the chordae tendineae prevent the cusps of the valves from flowing backwards into the atria, or prolapsing back into the atria. Now, the semilunar valves work in a whole different way. The semilunar valves are wide open during ventricular systole because that blood needs to leave the ventricles and go out to the lungs and the systemic loop. But it also needs to close during diastole. And what happens is, during diastole, as interventricular pressure is dropping, blood begins to flow back toward the ventricles, but it catches these cusps and it brings them into very close approximation so that it actually closes the valves. Now we can see the base of the heart here has been incised. Here is the right auricle. We can see the left auricle is there. The semilunar pulmonary valve is anterior and the aortic valve is posterior. If you're ever hurting to distinguish one from the other, you can quickly look to see that the aortic valve should be in association with the ascending aorta, which has the left coronary artery and the right coronary artery in association with it. Now these semilunar valves have three cusps each. The pulmonary valve is going to have an anterior cusp and then left and right cusps. The aortic valve will have left and right cusps and a posterior cusp. And so what we can see is that the right cusps of the valve align and the left cusps of the valves align, and then there's an anterior and a posterior cusp. So these are the semilunar valves, and they work very distinctly differently than the atrioventricular valves. Thank you very much for your time.